Good evening and welcome to our health and safety webinar for the 2021-2022 school year. My name is Fred Rundle. I'm the Deputy Superintendent for our school district. If you joined the other evening and you're wondering why there's only 4 of us now, we did have some technical difficulties, and so we're re-recording the first half of the meeting, and then halfway through it we'll pick up with our previously recorded event. But we wanted to make sure that we had all of the information available to our community members. So I'm going to give a chance for our 3 guests to introduce themselves, and then we'll get started with some of our questions. Shelley, you want to start? I think you're on mute, Shelley.
Sorry, I think we're covering the positive COVID test or close contact.
Yeah, just introduce yourself first.
I'm sorry. This is Shelley Sage. I'm the school nurse at Mercer Island High School, and I am one of the ESA nurses. And Karla is the other one. She's down at IMS. We kind of handle some of the heavy lifting on COVID for the school district.
Hi, everybody.
And Dr. Evans.
Hi, I am Elizabeth Evans, and I'm a parent of 2 high schoolers, and I'm PTA council president this year, and I'm also a pediatrician at Mercer Island Pediatrics.
Great. Thank you to the 3 of you. I think it's important for all of our community to remember that our strategy from the very beginning has been to follow the guidance that we're offered by the Department of Health to the very best of our ability, and really use the multi-layered approach to mitigating against the spread of COVID-19. And so as our schools opened up here for the 2021-2022 school year, we've been putting in place physical distancing, proactive hygiene, wearing masks indoors, promoting our families to stay home or keep their children home when not feeling well, and certainly keeping our schools ventilated and bringing in only outside air. So we will continue with that, and I assure our community that as conditions change, as guidance change, and as our lived experience changes, we will amend our policies and procedures, and we'll respond so that we keep our schools as safe and healthy as possible. Another big topic in the news recently, particularly with public schools, has been vaccinations. And just to remind everyone that Governor Inslee and the Department of Health have mandated that by October 18th, all volunteers and staff members who work in schools or who are volunteering in schools must show proof of vaccination. At this point, we have a very high rate of vaccination amongst our staff, and we're seeing similar trends amongst our students. But speaking of our students, as a reminder, the vaccination requirement does not apply to our students. Our students do not need to show a proof of vaccination for COVID-19 at this time. We know that a number of our students, in fact, a high percentage have received at least one of the vaccinations or their vaccination shots, if not both. And so we track that and we're monitoring that. And as you'll learn today, that's really because of our contact tracing. And then lastly, for our families who have younger children who are not yet of an age that the vaccination is available, when that becomes available, we will be partnering again with an outside entity. Last year it was Costco, and that might be the same this year, to make those as available as possible to our community. So as we're going through, we definitely talk about the guidance and the recommendation that comes from the DOH and mandates. And there are some things that are recommended that may or may not be implemented right now. Everything is always under consideration over the long haul. So with that, I want to go ahead and get started and get some questions for our panelists. So I want to start with you, Dr. Evans. If you can just begin with just some overall guidance to parents who have kids who are home and they are experiencing maybe some symptoms, maybe not, they're just not feeling well. What's the guidance that you're giving as a physician? And then also some parent ideas about, when to keep kids home from school.
So What we've been seeing with children that are positive for COVID is they can have a myriad of symptoms: headache, fatigue, fever, cough, cold symptoms, GI symptoms such as vomiting and diarrhea. So it's best to err on on the side of caution. If your child wakes up and says they're not feeling well, better to not send them to school that day and watch them and see how their symptoms progress and get them tested if they do have any of those symptoms. Don't send your child back to school while they're waiting for the test results to come back. Again, err on the side of caution and get your child tested. Wait until those test results come back. Make sure that your child is fever free for at least 24 hours without the use of a fever reducing medicine such as Tylenol or ibuprofen, and make sure that their symptoms are improving. If they are COVID negative and those are true, then your child could come back to school.
And a lot of times, or we've seen out on the market, access to the rapid antigen test down at local grocery stores or drugstores or online. Can you talk to us a little bit about the difference between the PCR and the rapid antigen tests that are available?
Sure. The PCR is really the gold standard test. It has an extremely high specificity and sensitivity, which means that there are very few false positives and false negatives. So a PCR is the best way to test. An antigen test is a rapid test. Those usually come back with results in about 15 minutes. However, they're not as good if your child is asymptomatic. So, if your child has been exposed and you're wondering if they're positive, that really isn't going to give you the results that you want, and you should do a PCR. If your child is symptomatic, they've got fever, cough, GI symptoms, fatigue, whatever, then you could run an antigen test. If it's negative, it could be a false negative. So always better to do a PCR afterwards to confirm.
Great. And just for our community, and you'll hear more about this, we have the rapid antigen tests in our schools, and we are using those, and you'll learn a little bit more about that tonight. But I think that guidance is important around really understanding what the PCR test is designed to do versus the rapid antigen, and why our school nurse might be requiring one or the other as we're communicating. Shelley, can you talk a little bit about if a parent over the weekend their child tests positive, or they go to a doctor for a day and they get that positive test, what should they do with that information, and who should they tell at the school?
Yeah, the parent needs to call their school nurse or their school administrator right away, email or a phone call. We're all watching our email and cell phones very closely these days, and trying to pick up these positives, and so we can act on them as quickly as possible. So don't worry about contacting us on a weekend with an email and such. We will want to get on that as soon as possible.
Great. And one of the questions that we've received, certainly from parents who are understandably nervous about sending their kids back to school this year, is if my child is in a fourth grade classroom, or my child is on an athletic team, and one of the other students or athletes test positive, will I know about that? And I kind of want to answer that in two ways for our community. First and foremost, if your child is in a classroom and another student has tested positive, you are going to be informed via email. We're not going to disclose who that student is, but we do want to make sure we're being transparent so that you as a parent at home or guardian can be looking out and monitoring your child. The other scenario is your child is in a classroom or on a team or in a club or organization, and not only has your child been there, but your child's a close contact. You're going to get a different email, and in fact, you're probably going to get a call from our school letting you know what are the conditions of that close contact, and what does that mean for participation in school. So we will be transparent with families. We won't be communicating at the school level, but we certainly will at the classroom level. Along those lines, then, Karla, if a student does test positive for COVID-19, can you help us all understand some of the thinking around when that student can return to school?
Sure, Fred. The guidance for returning to school after you test positive for COVID hasn't really changed over the past year at all. If you test positive for COVID, you stay home from school from either 10 days from the onset of symptoms, if you are having symptoms of COVID, or 10 days from the date of testing, if you aren't having symptoms of COVID. And so we count day one, and then we give you a return to school date. We also, though, have to look at what's going on individually with each student. So if on day 10, a student or staff member is still having a fever and they're needing fever reducing medication, or they're having a very persistent cough, meaning they're coughing every 5 minutes, or they're coughing even every 10 minutes, that's a pretty significant cough. They probably and most likely still have a pretty high viral load, and we don't want them coming back to school. So the 10 days is the minimum that someone would stay home if they are positive for COVID, but it's not necessarily, it could actually go longer than that depending on what symptoms they're experiencing, because the guidance is, and symptoms are improving and fever free for 24 hours prior to return. So that's where it will be really important for families and staff to work closely with their school nurse so you can determine when to return to school.
And there's some confusion about whether or not a student is vaccinated, and does that change that? That if I'm vaccinated, can that shrink it down to a fewer number of days or whatnot?
I'm so glad you asked that question. It's though I planted it with you. So your vaccine status actually does not shorten your isolation timeline. If you test positive for COVID by PCR, we'll start with the PCR. If you test positive by COVID by PCR, you're out for 10 days. And that's just what we do.
Great. And Shelley, if a school nurse has recommended that we do a rapid test, which we offer at the school, but the family would prefer to seek that in another venue, is the school district taking rapid antigen tests that someone's purchased in drugstores or online, or do they need to seek that from a medical provider?
Yeah, we do not accept testing that has been done at home. All the testing needs to be done by a professional and have it professionally administered to make sure that we get accurate results. That's very important. And PCR testing, again, is the gold standard, and that's what we typically recommend people do.
Great.
I did want to just clarify that the one thing about the antigen testing, it is a self-administered test. It's just that we need to observe it to make sure that the swab is inserted far enough and that enough samples and rotations are going around so that we know that there's been an adequate sample taken to look at the results when we process them. But a student or parent must administer the test to themselves or the student. Right. Themselves meaning the student would administer it themselves.
Another question that I just wanted to clarify too from families has been, is it possible that an entire class would have to quarantine? And that is possible, that an entire class through contact tracing would have to quarantine. And so each of our schools has already built, and we hope we never have to use it. But in the event we do, we have built remote schedules already so that learning loss can be really minimized and we can maintain that instructional time. But those are just in case they are. We also have contingency plans for a teacher who may be at home, either in quarantine or COVID positive, but in isolation, but feeling well enough to teach. And we can be setting up Zoom options and some others so that the teacher can keep teaching as well. Moving a little bit kind of in the same direction, Shelley, can you talk about the contact tracing that you and the other nurses do as far as a school district? What does that look like?
Yeah, we do the contact tracing when we get a report of a positive, and we call up the family member of the individual who has tested positive. If it's an older student, sometimes we interview them as well, and we will get as much detail as we can with regards to other contacts within the school building and community. We don't contact trace outside of the school community, such as, shopping at Starbucks or the QFC and whatnot. We leave that to the health department, and all of our positive contacts and results are reported out to King County Public Health, and then they would then do their own follow-up within the greater community.
Great. And as families saw during the RSVP process, we have been asking about vaccination status, and that's really to help us with what Shelley just described, and that's the contact tracing. But just to kind of reiterate, Karla, can you just, you touched on it, but just really reiterate that if my child is vaccinated and there was a close contact at school, do they need to quarantine, or what does it look like for their school participation?
Once again, we'll definitely investigate what scenario and how the close contact occurred. But if it were easily just happening in the class, if it was happening in the classroom, we would, I'm sorry, I'm having a really hard time following here. Can you, and I appreciate that people are watching this. Can you just say the question one more time? I lost my train of thought.
Yeah, no, absolutely. If if my child's vaccinated and you call and say they're a close contact at school, what does that mean for my child?
Okay, the current guidance is that if you are a vaccinated person, because we are seeing some breakthrough cases of COVID, especially with Delta in vaccinated people, that you do need to test for COVID. So you should proceed with getting a PCR test 3 to 5 days after your exposure. But you do not have to, at this point in time, stay home because you don't have symptoms and you're vaccinated. That's what the current guidance tells us. If you don't have symptoms and you're vaccinated, get a test 3 to 5 days after exposure, but you can continue going about your day.
Great. And I want to just kind of go over a little bit with our families. If your child does test positive and they're in isolation or quarantine for an extended period of time, or they're quarantining because of a close contact, we have been working as a school district, and we will work with families to use either live Zooming or recorded lessons for our students to continue to access their education. But I remind everyone that, video recordings or live Zooms is really only one way that we can interact with one another. I think we have to remember that the goal is to make sure that students can continue to access education and make progress and not fall behind. And how we achieve that, Zooming into a classroom may not be the best way. It might be setting up a time to meet with the teacher and then having work brought home and having touch points. So we'll work with families to make that available, but our goal is to make sure that a quarantine situation isn't a barrier to a student's education. Turning towards physical distancing a little bit, what's the current expectation in our schools for physical distancing?
I'll go ahead and take that one.
Okay.
So the guidance from our state is first and foremost, get kids back into the buildings, and hopefully you could do that at 3 feet. That's the recommended guidance. So we do want to try to keep kids at 3 feet to the best of our abilities when they're in classrooms. The classrooms have been designed to minimize the number of students that can be there, but that all students have access at all times to education. And so there may be some classrooms where we have to do less than 3 feet. That's okay, because we do need to we want to make sure kids are getting their education.
Great. And kind of with that, Shelley, if you'll just build on that, what kinds of ways are schools enforcing either mask wearing or physical distancing? What are some things that that you're seeing in the schools?
We have supplies, all the nurses do in their health rooms. If a student has lost their mask or it's become soiled, we'll give them another one. I think the staff do gentle reminders to pull that mask up if it's slipped down under their chin or nose. And then again, we can also offer them hopefully a better fitting one from one of our supplies here in the health rooms if it just seems a little too large for the child's face. We do have a variety of sizes. We have Tony Coons has done a great job in supplying the district with various different types of masks that we can make available as needed. with the distancing, you might have seen the little circle dots that you've seen as reminders for the students and staff to space out if they're waiting in a line and such. And again, gentle reminders to the students not to bunch up and get too close to one another. And then for like lunchrooms and whatnot, they're allowed to eat outside here at the high school. It's weather dependent, it's safer because I know the masks have to be off while they're eating. But just a lot of reminders. The kids have been really good about it. I've been here today and they've all been around. And there's some passing in the hallways and whatnot, but those interactions are very brief as they keep moving through the space. And the mask wearing has been very, very well adhered to, as I've noticed here today on the first day of school.
Great. Before we end this session and return back to the original broadcast, anything else that the three of you would like to share with regard to health and safety from the medical professional side to just offer our community?
Well, I would say that we know that school is not just about academics. There's social emotional learning, there's access to exercise, there's access to mental health. There's lots of benefits that school provides. And that's what we really want for our community, is for our kids to be back in school. So be cautious, help your kids understand why we're doing the things that we're doing, why we're practicing social distancing, why we're practicing mask wearing. Be cautious in your activities outside of school, making sure that our community can provide this education and these resources to our children and keep them in school. I think that's really what this is all about, and to do it safely. And I think as a community, we can do that. And be supportive of your children going back to school. I think this is something that is so important for our kids, and we're all working very hard to make sure that that happens.
Shelley or Karla, anything to add?
No, we know the community, we're working all together to get kids back to school and to do it as safely as we can. We just want to remind you, please don't send your children to school if they aren't feeling well, and then work with either your doctor or with your school nurse to figure out your next steps so that we can get your kids back to school as quickly as possible in a safe manner for everybody. Thank you.
Great. All right, we will return back to our original broadcast where our principals will be talking about recess. Thank you and have a great day. Want to turn our attention to recess and allow our elementary team to talk a little bit about what students might expect out at recess, or what parents might hear about recess. And in particular, if you could talk a little bit about, can students still wear a mask even though it's not being required, and will the school encourage that? Heidi, can you start off with that? And I believe Amy, I think you wanted to chime in on some of these as well.
Yeah, sure. Happy to. So out at recess, masks are definitely optional. They're not restricted, and they're not required, but they are optional. We will be teaching students about kind of being mask aware outside, so that if they are in a space where they're playing very close together, take a break, they can walk away from it, take a break. They'll likely have their mask with them, so they can put their mask on it at recess. We're also limiting kind of our closer contact type of activities, things like, I don't know, flag football, that kind of thing is being limited out there. Amy, if you want to jump in, I'm happy to.
Yeah, I'll give it a shot. I'm having some internet issues. So I apologize for my glitchiness. Yeah, I think we'll be continuing to encourage kids to keep that distance from one another, even though they're outside, as we did last year at recesses. So that teaching and that encouragement will continue. And one of the things to remember for our families is each of you get to make the choice for your family as to what you expect, and your kids, they'll listen to you. So if you say to them that your family's choice is you prefer that they wear masks at recess, please let the kids know that, and they will listen to you. But then, if your choice is that they don't have to wear masks, that is currently, according to guidance, available to them as well.
I would just add also that throughout the day, and especially at recess, for those who will be wearing masks all day, we will, like last year, if they really need a mask break, we'll make sure they're isolated from everybody else outside to take a quick breath and remove their mask. So we will be consistent with what we did last year, because we do know some students just need a short break to breathe without a mask. So we will accommodate those requests from students also. And our adults will be wearing masks outside.
So kind of moving to before we move away from recess and head into lunch and snack, which we've received a number of inquiries about that. Erin Battersby, were you also wanting to jump in? Anything else on masking or masks or face coverings?
I can just say that we are encouraging all unvaccinated persons, whether they, irrespective of age, to wear masks outdoors, because that's consistent with the Department of Health guidance, but it's not a requirement. And as our elementary principals described, we are setting up sort of playground rules and expectations that would, even outside, promote physical distancing between our students within the reasonable bounds of children's play. So I think that is encouraging. At no time would a student or staff member be discouraged from wearing a mask should they so choose. And if for any reason a student feels uncomfortable or feels that one of their peers is making them feel bad about wearing a mask, we encourage them to speak with a trusted adult or their principal so that we can address that, because we do want to support our families and our students in making good choices and choices that are consistent with what their parents want.
Great. Thank you for that clarification and those additions. Let's turn towards lunch, and I'm going to start with elementary, then we'll go to middle school and into high school. I think, Megan, you were going to start off, and I know our elementary principals even published a document as recently as just this afternoon, trying to clarify some of the expectations and what students might experience when at lunch. But obviously we're continuing to listen. So Megan, can you talk a little bit about elementary lunch and conversations you've been having?
Sure. Thanks, Fred. Obviously, our facilities are slightly different depending on the building, but in all locations, we have a few key mitigation strategies in place. Obviously, we have a large space that we're utilizing for our lunchtime, whether it be the lunchroom or gym space in your respective elementary, which provides a lot of ventilation, which Tony Kuhn can give some details on. Ventilation with our system and with all of the doors and spaces to provide cross air in that location. We're utilizing the plexiglass dividers and fewer students at each of the lunchroom tables, utilizing maximum space, including additional room that's off of the lunchroom in some buildings, or the stage that's off of the lunchroom. So really maximizing the space that we have. We did send communication this afternoon, just shortly before this webinar, describing some of those strategies, and that we're also, gauging our interest from our community about having a possible outdoor picnic style lunch option, which that type of option, should we further explore it, would be students sitting on a 6 foot apart dot under a cover or not under a cover, given the space, just for lunch eating purposes. And that's something we can explore based on interest. But right now we have a pretty robust system within our indoor spaces, and perhaps Tony can speak more to the ventilation piece as well.
And Tony, in particular, as you covered that, can you speak to some of the recent publications? I think the New York Times had an article about the dividers and some of the commentary on that.
Yeah, so the plexiglass dividers that we're talking about are little three-sided dividers that we're setting on the lunchroom tables to create more or less of a cubicle type of a space for the students to sit with. There was some publications that came out in the last week or so from the New York Times that talked about whether or not these were truly a safe alternative in the classrooms. And I just wanted to stress that, we're not using these in the classroom. We're using these in the multipurpose room, which is a much larger space, and the airflow and air exchange within that space is much greater than you would see in a classroom. So with that is the reason we're not concerned with using these dividers in the classroom setting, or excuse me, in the lunchroom setting. Between that and having the doors open, as Megan mentioned, to get some cross ventilation in there as well, as we're pumping in that outside air, it just gives it more of a release point. So
Great. Principals, anything else on elementary lunches before I turn over to Mary Jo?
I think we were going to quickly, and maybe this is a different question, Fred, just about checking your child out if you don't want them to eat lunch at school. Is this the time to address that?
Yeah, why don't we, since it's in that topic anyway, it was going to come up later, but I think it fits here. So the question has really come from some of the families who have said, I'm not sure about whether or not lunch is a time of the day that I feel most comfortable with. Can I come and check my student out, or can I check a number of students out? And so, David, do you want to speak to that a little bit?
Yes, of course, you can check your student out. Obviously, you would need to do that at the office. If you're checking out other students, we would need permission from each of those families of those students for you to check those students out. Please note that our office staff will be taxed in terms of the energy to check students out, so plan accordingly. And some of our office staff also do cafeteria supervision, so we may be a little lightly staffed during those times. We are asking you also to be aware when your student does eat lunch and when their recess is, because it's a finite amount of time that they're away from their academics. And so plan accordingly. We would also make sure that you check your students back into school after you've checked them out. And we are also asking that you have that lunch outside of the campus, whether it's in a car off campus. So that's the basics of just if you're planning on having your student eat lunch away from school.
Great.
I could just add to our request, please don't come too early to pick up your child. Don't try to beat the rush. Just, it's very disruptive when we're having to call into classrooms to call students out to be checked out. So
great. I want to welcome in Mary Jo Budges, our principal or co-principal at the middle school, who is going to talk a little bit about the middle school lunch options. And as we get into middle school and high school, just reminding everyone that albeit a hybrid model last year, our middle schoolers and our high schoolers were at school throughout the day on their day in. So we may have a little different urgency around that, but refresh our memory, Mary Jo.
Yeah, we feel really confident about our practices, having done it for the last 3.5 months of last year. So our students will be sitting in chairs. There are no tables available for them in the lunchroom. And actually, it's amazing. Our lunchroom was way cleaner in the spring than it's ever been in years past. So the tables didn't seem to be a negative factor, actually a positive one. So the chairs are 6 feet apart. There are QR codes beneath the chairs. Kids check in at where they're seated, which allows us to contact trace if necessary. We will be expanding our seating into our gyms, potentially dependent on need. And we have a large outside space with dots that are located 6 feet apart for kids to be able to sit both under cover and outside of the cover. This year, we are actually bringing back trays as well. So thanks to Carol Buss on that. And we think that will actually help with eating in the lap. So it'll give a more sturdy surface for kids who are purchasing their lunches. And overall, it went very smoothly last year, and we anticipate the same again this year.
Great. And Walter, if you want to talk a little bit about the high school. I know K-8 we have closed campuses, and the high school with the open campus, reminders on that, and just overall process for lunches at the high school.
Sure, thanks, Dr. Rundle. First, most students leave campus for lunch and eat at home or away because we have open campus for 10th through 12th grade students, which does reduce our numbers significantly. Our cafeteria is quite large. We have 2 lunches. We also have 3 open spaces at which students are encouraged to eat outdoors when possible. Students will be required to mask when not eating or drinking in the cafeteria, or the commons as it's commonly called. Students will be distanced in their area in the cafeteria. While we will have tables, we'll be spacing students apart at those tables. And then kind of think about it or put perspective on it, with 2 lunches and about 1/3 of our student body eating on campus, that really means we host about 250 students in this large area, and about 1/2 typically eat outdoors. So even with that 250 students, we have enough space for distance. We're typically more spread out than that. And we are allowing and encouraging our students to go outdoors to eat when they can. Just as a reminder, also, as was mentioned earlier, we do have MERV 13 air filtration that runs continuously through our school, including the commons. And again, we'll do everything to make sure that we monitor that and keep our students safe. Thank you, Dr. Rundle.
Great, thank you. And now I want to bring in Carol Buss. Carol is our Director of Nutrition Services. She has been with the district for many years, but I want to say that all the way through the response to this pandemic, she has continued to adapt right along with us to make sure that our students could continue eating not only at home, providing meals to go, but then last year doing a hybrid of both, and now a new challenges this year. And so, Carol, if you would talk a little bit about the lunch options and how lunch is going to be handled this year at the 3 different levels.
Thank you, Fred. Good evening. I just wanted to start with our food service staff has very, very high standards for food safety and personal safety. And as Mary Jo had mentioned, we were very successful last year in safely serving lunch to in-person students. So I'm very confident this year that we will be able to continue that and be able to provide a nutritious meal to all of our students. This year, the USDA has extended the free lunch for all National School Lunch Program students. Our elementaries and Islander Middle School are all on the National School Lunch Program. Full lunch is free to all K through 8 students, with extras or milk only being charged to students' accounts. Mercer Island School District, or Mercer Island High School, is not on the National School Lunch Program. It was taken off far before I came here due to lack of participation. So Mercer Island High School will continue to the pre-COVID program of paid lunches. All lunches here are all meals are a la carte. Lunch for qualified Mercer Island High School students, students who would qualify for the National School Lunch Program income guidelines will continue to be free, and that's courtesy of Chartwell's Food Services. They take those lunches. We do encourage, even though all lunches are at K through 8, that families continue to apply for free and reduced lunch if they feel that they qualify. There are many other benefits that may become available for those families with a free and reduced lunch application. Those applications can be found on the Mercer Island School District Food Service webpage. I do want to reiterate, at the high school, even though it's paid, we will never ever turn a child away for a lunch. So families in need will still be taken care of. All prior lunch balances will stay with the student's account. So if you had a balance, whether it be positive or negative, when we close school on March 13th, that balance will follow your child and will be up and running again. So those funds will be available.
Great, thank you, Carol. I know that our students are looking forward to coming back and enjoying some of those meals, but thank you for everything you've been doing behind the scenes to make sure we can launch this successfully.
My pleasure.
Patrick Rock, our Director of Transportation, is joining us as well this evening. We've been transporting students since literally at the end of the first, I guess was the second week of school in September last year, when we started transporting some of our students who were coming in for appointments, receiving various services in the schools. And this year, I know that we're going to continue something we started last year, which is transporting our high schoolers and not depending on Metro. So Patrick, can you talk a little bit about transportation and not only safety procedures, but anything new that families need to know about transportation this year?
So I'm really excited. Last year we had, like Fred said, we were transporting students from September 8th on throughout the whole year. We never had any close contacts or any exposure on the buses that were concerned. And we're going to kind of continue on the same way where number one is, first of all, don't send your child to school sick. And so that's our best and safest way on the bus, that everybody on the bus, while there's children on board, will be wearing masks. Every window will be opened about 1 inch down, which creates quite a lot of ventilation on a school bus. So layer your children. It will get cold at some point. And then we load from the first students on the bus go to the back of the bus in the window seats. So we create as much distancing as we can through that. And once all the window seats are filled, then we start filling the aisle seats. And as we need to, we start tripling up at some point. We will have to do that, but it will be a very short amount of time that anybody's in close contact on a bus. As far as any transportation, check out the transportation website. If you want to know where your school bus is, you can do that on our site. And that's it.
Thanks, Patrick. I think it's a point of pride amongst your drivers and you and the team that the bus, even last year when we were concerned, especially as we brought more and more students to school, that maybe that would be a place where we would see some transmission, and we did not. And we're going to hope to continue that this year. But thank you to all of the drivers and to you for promoting that safe environment. The last presenter tonight, I want to welcome in Tony Kuhn again and have Tony just talk a little bit about overall operations and maintenance. Tony is our Director of Operations and Maintenance for the school district. And so Tony, if you can talk to our community a little bit more about ventilation in our schools, what we've continued to promote, what we did to improve some of our systems, and things that we should all be aware of about our facilities. And you're on mute, and I did not mute you. That's yourself on this one.
Thank you. So in preparation for reopening last spring, we contracted with Metrics Engineering, who helped us with basically coming through and doing a full system evaluation of all of our HVAC units. The units themselves, the equipment, the systems, the controls, they basically ran the rack on all of our equipment. Someone had, I think Walter had mentioned, we have upgraded all of our filters and all of our units to MERV 13, which is the CDC recommended filtration level. We are also delivering 100% outside air 100% of the time. So we have created basically, I think Megan had mentioned, like a wind tunnel, and we really are pumping a lot of fresh air into the buildings all the time. The units are set to run from 5 a.m. to 10 p.m., which meets the pre and post occupancy purge. With these changes in place, our system's performance exceeds best practices and the ASHRAE guidance. The ASHRAE is the American Society of Heating, Refrigeration, and Air Conditioning Engineers. They kind of oversee what's going on with HVAC units. They are also the folks that CDC and Department of Health are in contact with on these different regulations. The full assessment is available on our website. I'd encourage you to read through that. It goes into a little bit more detail for you. There's also a video link that we have posted on our website. It's kind of a HVAC 101. It kind of gets into details a little bit and explains exactly how our systems work. And it's about a 7-minute video, and it's on our homepage. I think it's a YouTube link. So I would encourage you to take a peek at that. Another question we've heard a lot about is some teachers have windows open, some teachers have windows closed. What's the district's feeling on that? And it is, the opening windows is a recommendation by the CDC and ASHRAE, but it's not necessarily a requirement for systems such as ours that we're using here at Mercer Island Schools because of the way they perform. You know, right now, as I mentioned, we're providing 100% filtered outside air coming into the buildings. It's creating a pressurized space. By opening the windows, it does release that air a little bit more instead of coming through the exhaust system. Some drawbacks to the opening windows is, you know, especially at the elementary schools, their adjacency to the playgrounds, there's a lot of noise and distractions and things like that. Depending on doors opening, along with those windows openings, you're also introducing different, you know, pollens and dust, and at this time of the year, you know, wildfire smoke, which all of those things are filtered out through the MERV 13 filters if we allow the system to work as it is designed. So again, I think there's some great information on those two links on our website. I'd encourage you to take a peek at those, and if you do have questions, feel free to reach out to me. You're on mute this time, Mr. Rundle.
You caught me speeding. Gonna bring it back full circle as we look to kind of wind down our evening tonight. This isn't your only opportunity as a community to hear from us. We certainly welcome your emails and phone calls, especially as we're all returning back and we get ready for the year. But I wanted to circle back to just a couple other questions that I know that have come up. And so I'm going to go back to you, Karla, and just ask the question, you know, if there are, you know, a situation in a classroom, whether or not that's a third grade classroom or something else, is it possible that an entire class would have to quarantine through your contact tracing that you and the other nurses might be doing?
It's really going to depend on what's happening in the classroom and what information we get from teachers on behaviors and spacing. So we know that to the best of our ability in the majority of classrooms, students are going to be seated 3 feet or more apart. So the current guidance in public health is that if masks have stayed on the entire time and students have remained 3 feet apart, we do not have to quarantine unvaccinated students. But other things come into play, and based on what we hear from teachers, we then consult with public health to get their feedback as well. For instance, if we have a student that was sent to school really ill, they had their masks off, snack indoors, and tons of coughing was happening, that would be a different scenario where we may have to quarantine more students, even if the 3 foot of distancing was kept. So it's very activity specific as far as when we quarantine, but our COVID response plan does have some examples of when the 6 foot versus 3 foot comes into play, and how we'll try to do our best to make decisions. Did that answer it well enough for you? Okay.
Yep. And along those lines, I know there have been questions about what happens if a teacher has to quarantine, you know, and that they're out for an extended period of time, but they're still either able to keep teaching or whatnot. What are some provisions for that? Does someone want to kind of talk a little bit about those situations? All right, I can dive in on that one then. I'll answer my own question. We may have situations where we can bring in a paraeducator, we can bring in another adult to monitor a classroom while a teacher teaches remotely. But that's really going to be dependent upon the situation with the staff member and, you know, what they're experiencing and going through. So it's really going to be contingent. But if that can't happen, we do have guest teachers and substitutes who are ready to come into our schools and continue supporting our classrooms as well. And so again, that's going to be somewhat dependent as well. And so I think as we kind of go to close things up a little bit here this evening, I just want to reiterate our appreciation for our entire community for continuing to hang in there with us. We are all extremely excited about the upcoming school year. I see in the attendee list tonight a number of teachers who have joined, and my next comment would include them if they were on the screen as well. And that really is that We are surrounded by educators, and those on the screen, and I know our teachers coming on board have worked tirelessly again this summer. And I know there's lots of vacation time that's gone unused, and it's so that our schools can be ready to roll on Wednesday when we welcome back over 4,000 students into our school district, ready for this next school year. So Superintendent Kolaski, let me give you the final words tonight. But from all of us, certainly thank you for joining us, and Superintendent Kolaski, close us out.
I just want to remind everyone about that layered approach. We have considered every single aspect of that in each one of our schools. We know that that's going to be essential in keeping everyone healthy and safe. And as I was listening to Karla at the end there talk about a child who was coughing and was quite ill, I did have to cringe a little bit, because the big reminder, and I've heard Dr. Evans say this repeatedly, is if your child is sick, please keep them at home. We know that traditionally school's been really important and we want our kids to go, but that's really a mindset we need to change now. And same for staff. If you aren't well, we need you to stay home. That's one of the layered mitigation strategies. We're super excited for the 21-22 school years. We can't wait to see everyone on Wednesday, and then our kindergartners on Friday. Thank you all for listening and sending us your questions. We appreciate it. You are our partners in this as we move forward towards an exceptional school year. Thank you, everyone, and good night.